Want to understand antipsychotic side effects? It starts with dopamine. Let's break down the 4 dopamine pathways, the ones you must know for your PMHNP boards. These are high-yield topics. Mesolimbic pathway. In this area, excess dopamine. And excess dopamine will lead to positive symptoms of schizophrenia. And what does antipsychotics do here? Antipsychotics would reduce hallucinations and delusions. The second pathway will be the mesocortical pathway. And in this pathway, there is dopamine deficits. And when there's a deficit of dopamine in this area, we begin to experience negative symptoms. Antipsychotics don't help here. Increasing an antipsychotic would not be your best bet. Antipsychotics may worsen symptoms. And the third pathway is the nigrostriatal pathway. When you block dopamine here, that individual begins to experience extrapyramidal symptoms. So here you are thinking of tremors, rigidity, akathisia, and these are the classic side effects of EPS. Tuberoinfundibular pathway, dopamine blockade here increases prolactin level, and it leads to amenorrhea, galactorrhea, and sexual dysfunction. And in your options, you have the first generation antipsychotics and second generation antipsychotics. Of course, we've used first generation in the past, but if you study, you understand that the first generation antipsychotics have severe side effects. So why would a second generation antipsychotic be preferable compared to a first generation? If you understand the symptom profile or side effect profile, you will be able to pick the correct answer, which would be a second generation antipsychotic. So these are the way you begin to think about your questions before you pick an answer. So you read intentionally, go through the options, and then you decide to pick an option. So always read. You need to know if they're having movement issues, you are thinking about the nigrostriatal pathway. If they are having galactorrhea or enlarged breasts, or they complain of sexual dysfunction or amenorrhea, you want to be thinking that there's a shortage in the tuberoinfundibular pathway. So just kind of think, read the questions and do a quick thought, but you don't want to spend too much time on a question. If you're spending too much time, you need to pick one and move on. You pick the best answer and you move to the next question, and you can mark it aside. And if you have time at the end of the day, you can revisit that question.